This week, we're going to examine healthcare around the world and some of the issues associated with healthcare in the developed, the developing, and the emerging markets. Healthcare is one of those things that hopefully we never really have to encounter a great deal of challenges with it, but the reality is we often will, at some point in the course of our life, have to deal with the healthcare system. And there are challenges in many parts of the world dealing with healthcare systems. So we're going to examine how healthcare affects an economy and how an economy is affected by healthcare. So as we'll remember, there has been, since the 1900s, a very fast and large increase in the global population. And much of that population has been residing in the developing countries of the world. But what we want to dig a little bit deeper in looking at our healthcare around the world, we have to recognize that the world's population is getting older. And they estimate that by 2025, of our 7 billion or so individuals, we'll have almost 1.2 billion of them over the age of 60. So along with old age comes a variety of healthcare challenges. So let's just have a little bit of background into healthcare, a little bit in terms of the trends of the provision of healthcare and the needs of healthcare. So unfortunately, there are right now currently about 1 billion people out of a 7 billion population in this world. About 1 billion of them lack access to healthcare. And what this really means is they have no means of providing healthcare for themselves, their families, their children, their parents. There is no hospital close by. There are no doctors close by. They can't access medicine very easily, and it presents quite a challenge for these populations. So if we look at where the doctors are around the world, interestingly, the doctors tend to be most prevalent in parts of Western Europe, Australia, and obviously in North America, the United States and Canada. There's fewer doctors prevalent in much of sub-Saharan Africa. And you'll also notice parts of Southeast Asia. There are few individuals who are physicians relative to the size of the population of those countries. Some other things that affect our healthcare around the world has to do with access to safe drinking water. Now you'll notice much of the world actually does have access to pretty safe drinking water, except for parts of sub-Saharan Africa and parts of Southeast Asia. The areas in oranges and yellows do not have as much access to safe drinking water. And along with that is access to sanitation. These are fundamental things that are required for basic hygiene. And again, you'll notice parts of sub-Saharan Africa, Southeast Asia do not have access to adequate sanitation facilities. So obviously, without access to sanitation and without access to clean water, you might have the prevalence of lots of diseases that are spread through polluted water sources. So unfortunately, there are right now over 7.5 million children who will die from something that really could be prevented. Either malnutrition, they do not have access to adequate amounts of food that's nutritious, or even preventable diseases. There are many diseases of the world that we know how to deal with, but in parts of the developing world in particular, the children don't have access to the means of protecting them from rather preventable diseases. So if you look at the under 5 mortality rate, again, you'll notice Sub-Saharan Africa, Southeast Asia, even parts of Central Asia, typically have a much higher percentage of their children who will die before they reach the age of 5. Much of the developing world in Europe, Australia, North America, they have much lower rates of under 5 mortality. However, you will notice that we have been doing better at reducing the under 5 mortality. Even within Africa, you can see the blue is in 1990 and the orange is 2016. You can see even in Africa, we pretty greatly reduced the under 5 mortality rate. And so we have made progress on healthcare for our children around the world. So part of this has to do with prenatal care. So this map shows the prevalence of prenatal care, and the areas in green have a higher prevalence of prenatal care. So you'll notice parts of South America and Central America all shaded in green, and even parts of Central Asia shaded in green. That means that there is access to prenatal care. Parts of Africa, you'll see in red, are really struggling with access to prenatal care. Now, I don't know if you can figure out why much of the northern hemisphere is not really shaded anything. It says it's not applicable. Why might that be? Obviously, we want our children to live, but consider this: in much of your advanced world, prenatal care is pretty commonplace. For example, if you were to become pregnant in Paducah, Kentucky, it's pretty commonplace that you'll have access to some kind of prenatal care. The areas that are shaded in red on this map, they don't have access to that kind of care. So unfortunately, 36 out of the 56 million deaths that happen each year are from what are called non-communicable diseases. So do you know what a non-communicable disease is? So that means it's not communicable. What that means is it's not going to spread person to person. So for example, the flu is a communicable disease. If one person has the flu, they can spread it to another person. There are many diseases that are spread through the blood system or exchange of bodily fluids. Those are communicable diseases. So a large portion of the deaths around the world happen from things that are non-communicable. So for example, cancer is non-communicable. If I were to have cancer, I'm not going to spread it to the class by teaching a class in a classroom. I can't spread it that way. Cancer doesn't spread that way. It's non-communicable. Now, if you look around the world, the highest rates of cancer death relative to the size of population are those areas in dark purple. So much of Asia, Central Asia, even Russia, there's a much higher prevalence of death relating to cancer. You'll notice much of North America, even Australia, South America, even parts of Europe are shaded in blue, and people do die of cancer, but not at the greatest rate in those developing countries. But you'll notice in parts of Africa, the death rate relating to cancer is actually pretty low. Any idea why that might be? So one possible explanation simply is that in individuals living in cancer either don't live long enough to get cancer, or they tend not to live in an environment which is causing cancer. So for example, they may not be getting lung cancer or any of those cancers related to smoking. They may not just simply be living in an environment that cancer is prevalent. But cancer actually is not the leading source of death around the world. Cardiovascular disease is the leading cause of death around the world. So cardiovascular obviously means related to the heart. And so if you look at cardiovascular diseases, people dying relating to heart disease, the areas in green are much higher prevalence than the areas that are shaded in yellow. So, for example, I often ask my class, if I were standing in front of the classroom right now in Paducah, Kentucky, and I were to have a heart attack right in front of the class, what would you do? Now, one year there was a class that was very hesitant in their answer, and I kind of just waited a while. And I said, don't you think somebody should call 911? I guess maybe they didn't like me, I don't know. But you think, okay, if you called 911 with a heart attack in Paducah, Kentucky, there's a hospital pretty much right across the road. There's a pretty good chance I'm not going to die of a heart attack in Paducah, Kentucky. But if I live in the middle of Ethiopia, in the middle of the sub-Saharan desert, and I had a heart attack, and the nearest hospital was 2 days walk away, I would probably die of my heart attack. So in the developing countries of the world, you tend to have heart attacks and you tend to die of them. Now this is a map that shows what are called dental caries. So essentially this is an infected tooth. What does infected teeth have to do with healthcare? Well, you may not realize this, but the infection actually can spread. And if you don't take care of your teeth, the infections actually can spread. So you'll notice the areas in red tend to have a high prevalence of dental caries. So you'll see parts of Europe have a high rate of tooth decay. Parts of South America have a high rate of tooth decay, and parts of Canada have a high rate of tooth decay. Notice the United States is in the yellow. It's a moderate rate of tooth decay. Well, why might that be? Well, consider this. In the United States, I know that at one time, even in the elementary schools, they promoted tooth care. I remember, they would line us up and give us a fluoride treatment in the elementary schools because we were drinking purified city water and we needed fluoride on our teeth. And so they would give it to the school children. In parts of South America, however, they have a diet which is changing towards a little bit more sugar consumption, but they don't have a great prevalence of tooth care. So you tend to get more tooth decay. So those emerging countries, such as in South America, they tend to have some of the highest problems relating to teeth. And it's cost almost $500 billion in terms of tooth decay. So another type of disease that is non-communicable person to person is malaria. Malaria is spread through mosquitoes. It's not spread from one person having malaria to another person. And you'll notice much of the southern hemisphere really is where the data was collected. And that's where they're most at risk for contracting malaria through infected mosquitoes. And you'll notice much of that area is emerging or lesser developed. And those are areas in which they don't have access really to very simple means of preventing malaria. A basic mosquito net is a very basic way to prevent malaria. You sleep underneath a mosquito net. So I remember when my daughter was working in Uganda and she lived with this family, they had one mosquito net and they gave it to the American guests. And my daughter felt very guilty about that because the children in the household then slept out in the open and they were likely to be bitten by mosquitoes. Now there is malaria medicine, but that's not always prevalent in those countries. And it's sometimes hard to get in those countries. So malaria is something that can be prevented, but in the developing world, it's still presenting quite a challenge. Now you've been hearing a lot in the news about the phrase pandemic. So a pandemic is something that spreads. For example, HIV or SARS or COVID, it spreads very quickly and it spreads worldwide. And so, for example, if we look at HIV, is a disease that has spread across the world, and it actually spread very quickly in the 1980s. Much of the emerging and developing world has figured out how to prevent and to deal with HIV. Much of sub-Saharan Africa has really struggled with preventing HIV. The SARS epidemic in the early 2000s, this was a respiratory disease, started in China, spread very quickly around the world. And if you consider the fact that people travel very quickly around the world, especially through an airplane, you can be in China in the morning and the next day you can be in the United States. And if you're infected, it's possible to spread those viruses. And so an epidemic is some kind of virus that has spread very quickly, very rapidly, and worldwide. It's not isolated to one or two countries. So for example, another example is the H1N1 flu in 2009. Started in Europe. There was a large number of deaths in much of Europe, and then spread very quickly to the emerging parts of the world from Europe. And obviously you've been seeing this map quite a lot lately as the COVID-19 was declared a pandemic. It is prevalent around the world. There really is no country that has been able to actually prove and document that there's no infections. There's some level of infection around the world. And this is a disease that spread very quickly. Now, some people often ask, well, when does a pandemic end? And I hate to say this, but it's not as though we're going to get a newspaper announcement that says, as of some date, the worldwide pandemic is now over. Pandemics end because they fizzle out. They fizzle out for a variety of reasons. Because of herd immunity, just more and more people become immune to it, and so the virus has no means of spreading. They fizzle out because of environmental conditions that change, and they fizzle out because of vaccines. So, for example, smallpox was a disease that was spread around the world, but smallpox has been eradicated because of heavy advocacy of a vaccine. There is a smallpox vaccine. They have actually eradicated the virus smallpox from around the world. There are only 2 known strands remaining of this virus, the smallpox virus. One is at the Center for Disease Control in the United States, and the other is at the Healthcare Administration in Russia. And those 2 countries possess the last remaining strains of smallpox. Theory is they ought to keep them because if you needed a vaccine is most likely to come from the actual disease itself. So if we completely eradicated smallpox, we would not be able to come up with another vaccine if smallpox were to ever mutate. And that might be a challenge for us. So viruses can mutate, they can spread, and if it's a pandemic, that means they've spread very quickly. So what really should healthcare look like? There's several different levels of healthcare, and they're prevalent around the world in different amounts. So primary care is really that preventative care. It's the person who goes for an annual checkup, an annual visit, maybe even an annual eye vision test. That's primary care. The purpose of primary care is to keep on top of health, and you might be more likely to catch things if you can catch them early and then deal with them, which then leads to secondary care. Secondary care is where you have care that's of the specialist nature. So for example, you might have heart doctors and cancer doctors. They may or may not be in a hospital, but the key is they're specializing on one particular kind of issue relating to healthcare. So you may go to a family practitioner for an annual visit, and they may listen to your heart and say, oh, there's something wrong with your heart. And they'll send you to a heart specialist. And so you might get all kinds of tests and things relating to heart disease. Or if you don't have the secondary care, you end up in what's called tertiary care. So tertiary care is that hospital and critical level care that people tend to need in emergencies. So if you don't have access to secondary care or primary care, you might not catch it, and you may just all of a sudden one day have a heart attack and never realize that you even had a problem, and then you may or may not end up in a hospital. So let's look at healthcare in the developed countries of the world. Much of this care is now universal. Many governments in developed countries provide some kind of mechanism to pay for healthcare. So for example, in Britain, actually the healthcare workers in Britain are employees of the British government, and they're paid for by the British government. Canada has a system in which you could be a private doctor, but Canada will take care of paying the bills. And some countries have private insurance, but it's regulated such that everybody has access to that insurance. So interestingly, the United States was the last industrialized country to not have universal health care until the Affordable Care Act was passed under the Obama administration. There's now universal health care we now have a much smaller percentage of our population that does not have access to insurance. Now, remember, having access to insurance doesn't necessarily mean that you have access to the health care. In the United States, we spend an awful lot on health care. We have access to a lot of hospitals and doctors, and you name it, if something's wrong, there's probably a doctor you can go to and they'll work to fix it. We spend a lot of money on that. But there are other parts of even the developed world where you might not have access to the healthcare. So, for example, you may live in Russia. Russia has a healthcare system, and you have access to paying for healthcare. But if you live in much of Eastern Russia, you might not have access to a doctor or a hospital. You might have to go to Western Russia in order to access the hospitals of Moscow. So if you look around the world, obviously the advanced countries are shaded in blue, and we tend to spend the most on healthcare. Now, also remember, these are countries that are aging. So much of the advanced world is aging. Japan, over in Eastern Asia, they have one of the oldest populations in the world. They spend a lot of money on healthcare for that old population. So what about healthcare in developing countries? So while the United States spends over $8,000 per person on healthcare, in the Central African Republic, it was $16 per person per year. They don't really have access to healthcare. They don't have a way to pay for healthcare, and that becomes one of the challenges. Also remember from the unit on migration, many of those developing countries are experiencing brain drain. The doctors are leaving, and so they don't have access to doctors. Much of this expense is out of pocket. They don't have insurance in these developing countries, so they're having to pay out of pocket. And they may not even be able to pay money. They might have to pay chickens or goats or sheep or crops. That's called a barter system. So in the developing countries, much of that care is paid for out of pocket. Now, of the 3 levels of care, the developed world has all 3 levels. We have access to primary care physicians, specialists like heart doctors, and we have hospitals. What about the developing countries? Let's say those countries in sub-Saharan Africa, or maybe the emerging countries of South America or Southeast Asia. What level of care do you think they most likely possess? And it's not primary care. It's the tertiary care. It's the hospitals. So most of the cities in your developing countries will have the hospital, but there are no doctors out in the rural parts of those countries. So if you happen to contract a disease in the rural part of the country, you may have a long walk ahead of you to a hospital. You may just end up dying. You may see there are people that practice witch doctors and natural healing. They might try to do a lot of that, but they tend not to have access to the primary and secondary level. Developing countries mostly have access to tertiary level care. And they're going to be paying for that out of pocket. So again, if you notice in much of the sub-Saharan Africa, those areas in dark orange, those are the areas where a lot of the expenditure is paid out of pocket. So what have we discovered in today's lesson? We discussed a little bit about the trends in healthcare around the world, the aging population, the types of diseases that are affecting people in different parts of the world. We learned about the different types of healthcare systems, primary, secondary, and tertiary care. And we also looked at the differences in healthcare between the developing and the developed world. The developing world tends to pay out of pocket, and they tend not to have access to very much care, whereas the developed world tends to have access and the ability to pay for all the levels of healthcare. So I encourage you to consider carefully your own healthcare. Try to do the best you can in terms of taking care of your body. It's the only one you got. And recognize that there are people around the world, even in our own country, that are facing healthcare challenges. And each of these healthcare challenges is going to affect an economy. Either it pulls money out of the system for dealing with healthcare issues, as opposed to building roads and building schools and creating new jobs. It may be taking care of healthcare problems. It also leads to a good quality of life if you can take care of your health. But also know ultimately, if a population ages and then dies, their labor force disappears. So their GDP ultimately might be affected if they can't have a healthy working population. So I encourage you, do the best you can. I'm not perfect either, but do the best you can and take care of yourself.